Great. Thank you very much, Mr. Chairman. And thank you to all of our witnesses for being here this morning. I was the governor of Nebraska from 2015 till just this year, and we dealt with a number of disasters, and including the COVID pandemic, but also tornadoes, wildfires, flooding, you name it. And appreciate all your comments, specifically with regard to older Americans and Americans with disabilities, because they are disproportionately impacted for all the reasons that you've just outlined, whether it's the burden of paperwork or just people not thinking through how to be able to handle folks who have additional needs. And frankly, one of the things I also want to hit upon, well, two things I want to hit upon. One is just making sure that we are doing the planning ahead of time and how important that can be, but also not having a one-size-fit-all answer. According to the Surgeon General advisory, one of the things I also want to hit upon in that second part is with regard to loneliness, but I'll talk about planning first. One of the things that we did in Nebraska is we got a CDC grant that allowed us to establish in 2015 the Infection Control Assessment and Promotion Program. And that was a training program in conjunction with the University of Nebraska Medical Center to be able to actually go to our skilled nursing facilities and assisted living facilities to train them in infection control. And this is one of the things that allowed us to be able to perform relatively better with regard to those congregate living situations that we knew for older adults in particular were so dangerous with the COVID pandemic. Now, how you actually get states to make those kind of decisions ahead of time, I don't have a good answer for. I would love to say I was so smart and told people to do that. That was not the case. It was somebody in my Department of Health and Human Services who made the decision, working with the University of Nebraska Medical Center, to establish that program well in advance of the COVID pandemic to allow us to train our healthcare professionals in those facilities so that they had a leg up when the pandemic hit. And then, of course, we really ramped those programs up. So advanced planning can make a difference. We demonstrated here in Nebraska versus some other states, which, for example, made some of the horrible decisions about sending people who had COVID back into those types of facilities that led to additional problems. Another thing is just how we have to avoid having one-size-fit-all answers coming from the federal government, because that's one of the things that really leads to bad outcomes and poor health outcomes for our senior citizens and so forth. And this is where I was going to read this one. According to the Surgeon General advisory, loneliness and isolation have detrimental effects on public health. The National Academies of Sciences, Engineering, and Medicine reports loneliness and isolation in older adults are strongly associated with greater incidences of morbidity, cognitive decline, depression, anxiety, and a decreased quality of life, and increased risk of early death of all causes. And I know that specifically I've had a number of providers in Nebraska talk to me about this. One in particular is Papillion Manor, a skilled care nursing facility that has expressed strong dissatisfaction with CMS's COVID-19 regulations and its effects on parents. Residents report a loss of quality of life as a result of the isolation, which kept residents from events with other residents and other families. And Mr. Bidlack, it kind of gets to your point about having emergencies too long. Well after we didn't need to have the restrictions in Nebraska on, say, communal dining, CMS still had those regulations in place, which really contributed to this loneliness. And of course, Mr. Bidlack, you also mentioned all the $5 trillion in spending, which has helped contribute to inflation, which also hurts our older Americans. But what I'd like to do is just hit upon Dr. Abir. What sort of things did you see, or what sort of experience did you have with regard to kind of a one-size-fit-all answer coming from regulations that may give us an opportunity to look for some flexibility down the road in the future so we can have more of a flexible response to be able to help, whether it's the amount of paperwork for older Americans or Americans with disabilities or other sorts of rules that we might be able to take a look at to be able to get better outcomes?
Thank you so much for this question. So I think that one of the most important things is to understand the specific needs and vulnerabilities of these populations. And yes, plan in advance. And preparedness is one of the major paradigms of, again, preparedness, response, and recovery. The problem is that historically, we've treated, whether it is older adults or people with disabilities, almost similar to everyone else. Whereas given all the vulnerabilities, the needs are going to be different. The intensity of both social services and health services is going to be quite different. Advanced planning is the key. However, that is also extremely expensive. But it is an investment that is worthwhile. And comparisons with Denmark or Sweden or Switzerland, which are socialist countries that invest tremendously in their health system and social system infrastructures, have healthier populations as a result. And it's not the United States. So I think that we need to think differently because we have a significantly aging population. We have a population that in many instances does not have appropriate access or enough access to social services and healthcare. So I think that we need to think very hard and look back at the COVID-19 pandemic, which is, not just the pandemic of 100 years, but is the worst case scenario. So who would have planned for a 3-year public health emergency that touched every corner of our nation and cost us, who knows? So for decades to come, we're going to be measuring the impact on lives, on health in general, on loss of workforce, on loss of income, on loss of education, and so many other aspects of society. So we need to take a nice long look at this pandemic and the way that we didn't prepare for it and how we responded to it and how we're going to recover from it. And step back and say, how can we do better, particularly for the most vulnerable populations? Because if you do it right for those populations, you're going to get it right for everyone else as well.
Thank you, Dr. Beer. I would point out, again, in Nebraska, we did take some steps ahead of time in preparing, like our ICAP program, to do it. Again, wasn't mandated, but that's just how we chose to do it with our CDC grant. I'm sorry, Dr. Gale. I was looking at you when I said Dr. Gale or Dr. Beer, but I wanted to ask you the same question, if I may, Mr. Chairman. Could I have a little bit extra time to give Dr. Gale a chance?
Sure.
Again, in your experience, were there things that we could do to provide more flexibility to help us address populations that are older with disabilities?
Sure. I think we can't forget about the social context. I think my fellow panelists here also mentioned it, but when we consider what happened in COVID, right? In the beginning, it wasn't pharmaceutical that we went in terms of response. It wasn't infrastructural. It was a social mandate, right? It was to self-isolate, physical distance, or increase our use of technology to kind of continue our tasks. But that caused some problems, and I don't think we really understood what that was going to cause. And the reason why is because we don't actually fund a lot of the studies to study that. If we're going to increase spending around planning and preparedness, we actually need to know what we're planning and preparing for, and we actually need to know the individuals who are going to be impacted, and we need to invest in the research to do so. That research can't be focused solely on pharmaceutical outcomes because that wasn't our first step, that wasn't our first response. The other thing is I have lived in your state, and I lived in your state during the time that you were governor. And having visited Nebraska Medical Center, a lot of the things they had in place for infectious disease were because they also were dealing with, I think they dealt with Ebola at one point, and they already had a lot of stuff in place to deal with infectious disease where other states may not have. So that could be one of the things that made you guys a little bit, better in terms of preparing for this. And that is you had some space in having to deal with it before. So that's also very unique. And when we're thinking about vulnerability, we have to be cautious when we're trying to compare against different societies, not just because the societies are different, but because vulnerability is different across different societies. What makes us more vulnerable in one than another can also be because of social context. And so our vulnerability as an older adult here could be very different in another country. And we have to take that into consideration as well.
Yeah, Dr. Gale, thank you very much. You're exactly right with regard to UNMC. They are a leader in infectious disease control. We do have one of only 3 federally funded contained isolation places, and the only actually quarantine space that was federally funded. And we did handle the Ebola patients that were coming out of West Africa. So we did have the expertise on hand to be able to do things like the ICAP program. And I agree 100% that was kind of my point is, it is not going to be a one-size-fits-all answer. What may work in New York may not work in Nebraska and vice versa. So we do have to be flexible about it. So thank you very much
Thank you.
to all our witnesses again. And Mr. Bidlack, I was just going to say one last thing. When we started our emergency response in Nebraska, we did use our rainy day fund to be able to start funding it before the federal government actually got their program in place and started passing it. So anyway, thank you, Mr. Chairman, for being so patient with me as I take up all the time in your committee.